My name is Chris McCracken, and I am a program coordinator for the Women's Wellness Connection program. Today I will be reviewing WWC's Quality Assurance and Improvement Program requirements. I will be covering program performance indicators, quality assurance activities, and the contract monitoring system. Agencies are required to meet or exceed all established program performance indicators. Performance indicators are classified into two categories. The first category includes indicators required by the United States Centers for Disease Control and Prevention, the CDC, and are referred to as the CDC Core Performance Indicators. These indicators are evidence-based benchmarks established by the CDC to measure progress toward program goals for screening and quality clinical care. Two screening indicators focus on high-risk populations. The first is women who are rarely or have never been screened for cervical cancer. Rarely screened is defined as has not had a Pap test in the last 5 years. The indicator is 20% or more women receiving their first WWC Pap test should be rarely or never screened. The second at-risk population is women 50 and older getting breast cancer. This indicator is 75% or more of women receiving a screening mammogram should be age 50 or older. Four clinical core indicators focus on quality of care. The first clinical indicator is 90% or more of women with abnormal breast cancer screenings should receive complete follow-up care. Complete is defined as reaching the point of definitive cancer diagnosis. Is the diagnosis cancer or not cancer? Cervical screening has the same indicator. 90% or more of women with abnormal cervical cancer screenings should receive complete follow-up care. The final two clinical indicators address the timeliness of those completed cases. 75% or more of the women with complete follow-up for abnormal breast cancer screenings should receive that follow-up in 60 days or less, and 75% or more of the women with complete follow-up for abnormal cervical cancer screenings should receive that follow-up in 60 days or less. The second type of program performance indicators are those indicators required by the Colorado Department of Public Health and Environment. WWC developed these indicators because agencies that were most successful were also doing well in these four areas. Agencies must complete the enrollment process into BCCP Medicaid within 10 business days after a diagnosis of cancer or precancer for all enrolled clients. 90% of all data for all procedures must be entered into ECAST within 30 days of service being performed. At least one representative from every agency is required to attend at least 50% of meetings or conference calls hosted by WWC staff. This includes HIT calls and ECAST user group calls. Agencies can also make up attendance by reviewing a recording at a later time. To be meeting the spending indicator, agency spending must be no less than 5% under where we are in the fiscal year. For example, as of the February billing, we will be 62.5% through the fiscal year. So your agency should have spent at least 57.5% of your budget. WWC provides feedback to agencies as part of its quality assurance and quality improvement plan. The plan has many distinct activities that relate to agency performance in the areas of quality and compliance. Agencies are required to submit progress reports via online survey to provide status of deliverables and plans for improvement when deliverables have not been met. Agencies will also receive one end-of-year report from CDPHE summarizing whether or not deliverables were met. This report will support annual CMS ratings. WWC performs a program risk assessment annually to determine monitoring levels and which agencies may receive site visits. WWC staff conducts site visits at least 30% of WWC agencies every fiscal year. Site visits serve as an opportunity to highlight program successes, challenges encountered, lessons learned, useful tools, and provide technical assistance needs. Components of site visits include a chart audit, a site visit prep tool, discussion about program management, and a clinic tour. Pursuant to Colorado state law, WWC determines contract monitoring system, CMS, performance ratings for all contractors. The rating is developed based on 5 performance categories shown on this slide. Your agency will receive either a standard or below standard in each category and an overall rating annually. For more information on quality assurance and quality improvement, please review the provider toolkit found on the website or contact the WWC team.